right, what's going on, folks? I really could be back at my desk right now. I'm kind of able to sit there at my desk, but I'm just, I don't know, still, I want to take my time with the healing. Now, this is exactly what I wanted to speak on. This is not one of my, well, this channel is about whatever I fucking want to post. And I want to talk about Beaumont Army Medical Center here in El Paso, Texas. I swear to God, these fuckers are trying to kill me. There's just way too much. I've filed many complaints. Friends have filed many complaints. I've had friends who have died at Beaumont because of their goddamn incompetence. One, because they gave him a medication that's in his file that he was, do not give this to him, and they gave it to him, and he ended up dying. I have a severe allergy towards a medication, and for some strange reason, it took over a year, even though they found out at Beaumont that I was allergic to this medication. For some reason, it wouldn't stay in my file for well over a year. Every time I would go to the hospital, that year following, like over an entire year. But what are you allergic to? I'm allergic to this. As a matter of fact, there was when I broke my hand at one point, they almost gave it to me. I mean, I was already kind of out of it, but they were literally about to inject me with something without asking me first and without telling me what it was. Don't y'all have fucking procedures? As she's going to give me the shot, I was like, whoa, hold on a second. What is that? She told me what it was, and I was like, remember, I was kind of already out of it. The bone was sticking out of my hand and everything, you know? And I said, hold on a second. My mind is, of course, foggy, but let me go ahead and call a friend who knows that would remember about this because she was with me from the last time. Sure enough, what they were about to inject me with was the thing I was fucking allergic to. That, you know, well, yeah, I got shit to say about Del Sol. Fuck those people too. I've had friends who have died at Del Sol as well. I don't know what it is about the incompetence in this town. But yeah, I mean, she's literally holding the needle, about to inject me with something that can kill me. When I had it on speaker, when the person on speaker was like, oh, you're allergic to this. And the nurse kind of like puts the needle slowly down. And I was like, are you serious? You're literally about to inject me without even, I had already told you to wait. And she's still sitting there like about to inject me with the fucking shit. It's like, God damn it, you're about to fucking kill. It's like, oh my God, don't y'all have standard procedures? Aren't you supposed to tell the patient? I mean, I'm awake. You know, I'm awake, I'm aware, you know, barely. But don't y'all have procedures to ask these questions? But it was fucking ridiculous. It's like, how is this not in my file? It's already been 6 months. You know I'm allergic to this. Why is it not in my file? Okay, well, I'm going to enter it right now. Go to the hospital like a couple of months later, still not in my fucking file. It took over a year for it to stay in my file. I don't know. I have really no idea what the fuck is going on at Beaumont. That's just one occurrence. Then there's 2018, June of 2018, going for a routine surgery to remove a lipoma. And during that surgery, apparently they punctured my lung. They said nicked my lung. Like that's supposed to matter. Well, we nicked it. You punctured it. You know? But they didn't realize they had punctured my lung. Somebody had said, well, didn't they take x-rays before they like released you? And I was like, I don't know. How would I know that? And it's like, well, that's, as far as we know, that's standard procedure. They should have taken some kind of x-rays first before even releasing you. But no, they didn't do that. As a matter of fact, the doctor who ended up saving my life at Beaumont, but the doctor who ended up saving my life even said they should have taken x-rays. But anyway, so here we go. So they punctured my lung. Didn't realize that they punctured my lung. So they sent me home. Around 1 a.m., I'm like, no, it's around 12:30. Around 12:30 a.m., I'm like, I can't breathe. And I have severe breathing issues. I have to get Xolair shots every month. Cost over $7,000 a month because I have severe breathing issues, severe asthma. You know, I've got 3 chronic sinus infections. 3. 2 of them are staphylococcus, permanent. They're damaging to me, but not anyone else. And for the 3rd one, I can't remember what it is. Which is the reason why I've been inoculated with so many fucking things. Before the goddamn COVID even hit, I was inoculated with a whole bunch of shit because of the fact that I'm a high risk of dying. So I have my nebulizer for breathing treatments, all of that shit. The next step for me, if the Xolair were to stop working, would be oxygen, for me to be on oxygen. So, and even then, I have to do sinus rinses multiple times a day. And all the stupid fucking nasal shit and steroid shit and all kinds of crap that I have to in order to basically live a normal life. So I do a breathing treatment because I'm like, all right, I can't breathe. Well, that was it. Did the breathing treatment, my lung was already collapsing. The breathing treatment collapsed it fully. How was I supposed to fucking know that? So about 1 a.m., I call the hospital. They're on call, you're supposed to follow procedures. So I call their on-call doctor, ER doctor. And now let me explain something. I've been singing my entire life. Semi-professionally, I've been performing my entire life, like from the age of 5. So almost 50 years of singing and performing. I own a karaoke company. The first thing we are taught is to breathe. That's the first thing we're taught, is how to breathe. So breathing all the way to the diaphragm. So, even with one lung, I could still breathe. I could still survive. Don't know for how long, but I could still survive. I also have an extreme high pain tolerance, something they also know. I'm not normal. I'm not. They fucking know this. With my gallbladder surgery at Beaumont, oh my God, swear to God, they have fucked so much shit at Beaumont. So much shit up with me. Doctor's like, I don't even know how you're still alive. You should be dead. But when he comes rushing in after I came to, after the surgery, which was supposed to be, it's a routine surgery. We just need to take your gallbladder out. So, and I know I'm skipping to a different story real quick, but I wake up in the hospital, in the room, going, what the fuck am I doing here? I thought this was a outpatient kind of thing. It's like, he comes rushing in and he goes, how the hell? He goes, weren't you in pain? And I was like, I don't know why y'all don't keep this stuff in my file. I have an extreme high pain tolerance, like extreme. So for me to be in pain, it's like, no, it was more an annoyance than anything else. It's really one of those, if I'm in pain, a normal person would have already passed out from the pain. I don't know why they don't put this shit in your file. I don't know why they don't put that kind of information in your file. Meaning, he's not normal, we need to look for something else. See what I mean? There would be less confusion. I understand that we're rare, us with high pain tolerances and shit and things like that. I understand that we're rare people, but you do realize you almost kill us because you're too busy looking at normal shit instead of putting it in our file. They're not normal. We need to look for something else. Oh, yeah. See, that counts against us. That seriously counts against us. One of my sergeant major friends told me, he goes, people like us are an anomaly, and they have no idea how to deal with it. A normal person would already be like, oh my God. And we're going, yeah, okay. The reason why so many things have changed in my life, like the reason why I didn't die from my gallbladder, was because I had already promised him and other people that if I'm having like where it would be an annoying pain, go to the hospital because something is wrong. If we wait until it's major pain, it's almost like too late. So basically I ended up saving my own life because I was like, this has been annoying for like 2 days. So anyway, the doctor comes running into the room, and he's like, how the hell did you not realize you were in pain? And I was like, I don't even know what you're talking about. I was like, what are you talking about? It was just an annoying little pain. You said it was a normal surgery. He goes, no. He goes, we had to cut you open, move your insides to the side in order to get your gallbladder out. He goes, it was completely full, like distended. He was like, you should have died. He was like, he goes, and my wife at the time who was there, she goes, he's not normal. And it's just, again, if it was a normal person, yes, they would have already been in the hospital immediately, like 2 days prior. And even then, I was going to still be like, no, it's fine. But I had already made that promise that if it's annoying, and it was annoying for 48 hours, that's when I was like, okay, I'll go to the hospital. But my past self would have been like, oh, no, I don't care. It's been 48 hours. It's still annoying. Maybe I pulled something when I was at the gym. But again, so then there were complications I had from that. I'll go back to that later. Anyway, so let's get to the lung puncture. So I call, the doctor says, just take some pain pills. It's 1 a.m. Just take some pain pills, go back to sleep. You're just having pain from from the surgery. Don't worry about it. Just take a pain pill, go back to sleep. 30 minutes later. Thing is, I've also been, me and my friends, when we were in the martial arts, we didn't take your black belt factory kind of martial arts. No, we were in the martial arts where they could beat the shit out of you. Like two of my instructors in Taekwondo were from Korea. One of my other instructors was from, the Shaolin Temple in DC. It's like, these were the instructors that could beat the shit out of you with the rattan cane and shit. Real martial arts. None of that fucking point system bullshit, whatever. So we were already taught how to handle pain because they would literally beat the shit out of you, in order for you to know what pain feels like. We also were taught meditation, how to block pain, how to calm your mind, how to calm your spirit. Y'all may think that's witchcraft. That's not witchcraft. The Chinese have known this shit for thousands of years. So there are a lot of times where I've been, like when I've had my tooth impacted, like impacted. All I did was sit there all night because I didn't want to wake the wife up, you know, because she was sleeping peacefully, so I didn't want to wake her up. So I literally sat there all night just meditating to keep the pain at bay. And then finally that morning, it was like, we need to go to the dentist. The dentist was like, holy shit, you should have come here sooner. And again, at the time, you know, being married and all the shit she had been with me through, she was like, he has a high pain tolerance. He's not normal. I don't know why this stuff isn't in our files. Why they don't keep this information in our files. Because if you think about it, if it wasn't for the wife at the time, or this other friend, or B, who's been here these last, going on 10 years with the last few emergencies and surgeries and things, if it wasn't for them, and if it wasn't for me being conscious at the times, if I had been unconscious a lot of these times, these motherfuckers could have killed me many of these damn times. Many of these times. Because for some reason, they don't put that kind of information in your file, which makes no sense. It's almost like we're being punished because we're not normal. You know, anyway. So go to the hospital. So 30 minutes later, I'm like, nope, I really can't breathe. Something is wrong. Go to the ER. That doctor comes in. Another doctor, it was a male doctor this time, it was a female doctor who answered the phone. Male doctor, he goes, you know what? We're going to take some x-rays. Took some x-rays. 15 minutes later, comes running in with fucking alarms going off and shit. And I'm like, what the fuck is going on? I was thinking it was like one of the other patients or some shit or whatever. And it's like, get him in the trauma unit now. And I'm like, what the fuck is going on? And it's like, your lung is punctured. He goes, what happened? You know, what happened? You're like, what's going on? And I told him I had surgery today, blah, 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 blah. He goes, they punctured your lung. And so they're rushing me to the trauma unit and everything else. Anyway, so he's like, explain to me what happened. As I'm explaining what happened, the other doctor who was on the phone comes in and she's pleading like, I'm sorry. She looks at the other doctor. He's talking fine. So, listen to him. He's talking fine. So I didn't realize anything was wrong with him. And I said, let me explain something to you. I've been singing and performing my entire life. So the doctor finished what I was about to say. He goes, so he knows how to breathe, even with one lung. I was like, ooh, damn, this doctor's informative. Oh, shit. She goes, but how would I know that? That is true. That is true. You know what? When they have you fill out a questionnaire about your medical history and things, these are some of the things that they should have on your medical file. They really should. Like, do you have, like, certain training? Do you have combat training as far as combat medical training? Do you have first aid training? Some of this stuff really should be in your file. Because if you think about it, the fact that she didn't know this information and it's not in my file, she literally just assumed that it was just pain from the surgery. So my own knowledge, experience, and training was counting against me and almost killed me. Not that it was her fault, but at the same time, she just assumed, well, he's talking, so he's okay. You got to realize sometimes doctors pay attention to what the fucking patient tells you. Seriously. Not all of us are hypochondriacs, okay? So anyway, Oh, no, 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 no. I'll get to that in a second, Polar Bear. Oh, hi, Polar Bear, by the way. Um, yeah, funny you should mention that. Funny you should mention that. But I'll get to that in a second. So the doctor who did the surgery comes rushing in. I'm like, what are you doing here? He goes, well, you're my patient. They called me in. It was a complete accident that we punctured your lung. And I'm like, yeah, doc, I know. It's like, I don't think you tried to kill me on purpose, you know? And I'm literally laying there on the trauma table, dying. And I'm cracking jokes. The doctor who's there about to do the procedure, the pneumo dart to stick my lung and everything, he's like, are you fucking serious? And I'm going, what? He goes, you're sitting here dying on my table and you're cracking jokes. And I'm like, doc, if you read my file of how many times I've almost died and literally how much pain and suffering I've been through, this is nothing. It's like it really isn't. I mean, he goes, you could die any minute now, and you're like just cracking jokes and shit. But again, I'm not normal. I mean, it's in my military records, it's in my medical records. It's funny, I do have extreme anxiety, but then again, hello, you try dying almost, numerous fucking times. And these bastards almost killing you all the goddamn time and shit, and you don't have a sense of humor or high anxiety anyway. Anyway, so yeah, I'm in the hospital because they put the fucking pneumo dart, in my lung and everything to reinflate it and stuff and all that. But anyway, to answer your question or answer your but you said about no accountability, that there's no record of it. I go to get the post-operative report so I could take to my primary, who's an outside doctor, not at the VA. And my primary, who is a surgeon, mind you, he comes to see me and is like, hey, he's reading the file, and he goes, hey, explain to me again what happened. And I go through what happened, what I told you guys. He goes, hey, that's not what's written here. I said, excuse me? So he's showing the paperwork. On the paperwork, as you were saying, Polar Bear, that no, it wasn't in the, what was in the records was, now remember what I said, they punctured my lung, sent me home. In the records, it says, during the surgical procedure, we found out that, shit, I can't remember exactly, and I know I should just do an edited version of it anyway. But basically, during the surgery, we found out that there was a complication with his lung. We went ahead and performed a pneumo dart, they did. Performed a pneumo dart. And I was like, whoa, that's not what happened. I was like, they punctured my lung and sent me the fuck home for hours as I'm basically dying. He goes, that's not what's written here. And he was like, and I don't want to say this. He goes, but there's no way they could make this mistake. He goes, I don't want to officially say this. He goes, but I'm calling bullshit. So I go to the hospital when I get the chance, and I'm like, hey, I went to patient advocate, and I was like, hey, you need to change this because this is not what happened. So I had to wait a couple of days, come back, and the paperwork said the same it was reworded, said the same fucking shit. At this point, yeah, because even the patient advocate was like, this is extremely suspicious. She goes, they reworded it, but it says the same thing. He was like, because I had already told her, I said, my primary is even going, yeah, this is highly suspicious. And she goes, I can understand. She goes, let's give it a mistake for the first time. She goes, the fact that it's reworded, but says the same thing, she goes, I'm getting a little suspicious now. So she goes, no. So she called up there and she basically let them know, this says the same thing, it's just reworded. You need to fix this. Because she was even like, if this doesn't get fixed, you need to call a lawyer. So, and this is patient advocate for Beaumont. Really cool lady. Awesome. So sure enough, third time's the charm. The paperwork says exactly what it was supposed to say, everything the way it went, and I get a call to come see the doctor. So I go upstairs, because she goes, I don't know why he wants to talk to you, but he wants to speak to you. So I go upstairs, and I'm like, I'm angry. I am furious. But I'm like, I don't want to get arrested by the MPs. Just fucking chill. Just fucking chill. Because I was so angry, I wanted to punch him. I just wanted to beat the shit out of him. I was so angry. Because, I already had a friend who died at Beaumont. It's just too many suspicious things that have happened at Beaumont. There was also something else. It was a Dr. Wynn that me and another veteran friend of mine who's had problems at Beaumont, we filed full complaints against this ER doctor and he got removed. So this wasn't my first rodeo in dealing with the corruption of Beaumont. So I go to see him. As I said, I stayed calm. And he was like, well, it was just an honest mistake. And I calmly, but I said twice. And he goes, excuse me? I said, well, the paperwork originally said this. Then the second time it was just reworded, but said the same thing. Oh, well, I don't know. It's like one of the assistants or something. Basically, like shoving the blame onto someone else. And I said, okay, it's fine. It's fine, whatever. And I left. And my brother was like, man, I'm surprised you kept your composure, because I really was furious. I wanted to beat the shit out of this fucking doctor. I was so angry. It's like you almost killed me and then you try to cover it up. It's just, oh my God, the corruption of fucking Beaumont. So yeah, the other doctor, the Dr. Wen, who we got rid of, after they did my gallbladder surgery, I had complications and I kept saying something is wrong. Something's wrong. They kept doing scans, but they're like, no, there's nothing wrong. Nothing's showing up in the scans. I was like, I don't give a fuck about your damn scans. Your scans almost had me killed from the gallbladder surgery. I said, so I'm sick and tired of y'all trusting the scans. Something's wrong. Sure enough, they end up cutting me open and finding out there was like major scar tissue that didn't show up in their fucking scans, and they had to fix it. But at this point, after going to the ER multiple times and dealing with that piece of shit Dr. Wynn, I was like, that's it. I need to file a complaint. Well, I happened to talk to a friend of mine who's a veteran, and he goes, man, I've had the same problem with the same fucking doctor at Beaumont. So him and I together filed complaints against him and got him removed. So yeah, I don't know what it is about Beaumont. I really don't. So anyway, here we are to this story. Y'all know I had a knee surgery. Full knee replacement, total knee replacement. I'm allergic to the staples. I've always been allergic to the staples. I don't know why this doesn't stay in my fucking file that I'm allergic to the fucking staples. Like badly allergic. Which is weird because they're like, the first time it happened, they were like, oh no, nobody's allergic to the staples. Yeah, I've always been allergic to the staples. Mine, and so I had already warned this doctor before one of my other previous knee surgeries, hey, I'm allergic to the staples. He was like, nobody's allergic to the staples. I'm like, no, I pretty much am. And didn't believe me. Sure enough, staples. and my leg ballooned up. I mean, ballooned up bad. And by the time B had taken me to the doctor to be like, hey, something's not right, we were waiting for an hour and a half. I have never seen B that angry before. I've seen her in fights, but I have never seen her that angry. She could have been arrested. I mean, she was like literally about to tear the doctor's office apart. The other patients there were moving away. She was screaming at everybody. It was like, if he is in pain, something is fucking wrong. And sure enough, they come rushing out, bring me to the back, unwrap the bandages and everything else. My leg was fucking ballooned up. And the doctor's like, well, we don't know why this is happening, what's going on. And I'm like, it's the staples. He still refused to believe it. Nobody is allergic to the staples. They're blah, 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 whatever, hypoallergenic or whatever the fuck or some shit. Nobody's allergic to the staples. And I'm like, my leg was so swollen, they were afraid to even pull the staples by this point because they thought that basically the wound would just rip apart. So he goes, look, he was trying to find one that wouldn't be like an issue. And he goes, pull one of them and see what happens. He pulled, I said, no, pull one of the ones literally one of the ones that I could feel is the most bothersome. She pulled it. As soon as she pulled it, swelling started to go down. Yeah, I know. They use us for fucking experiments because of the goddamn border. I already know. The swelling started to immediately, we're talking immediately, an immediate reaction to her just pulling one of the staples. Swelling started to go down. She was like, I'll be darned. Goes to get the doctor and she goes, he's allergic to the staples. Doctor goes, are you fucking, he's like, are you kidding me? No one's allergic. And B goes, he is not normal. Again, I don't know what it is about people like us that we get fucked over so goddamn bad. You would think that we would be a blessing to mankind. Those of us who have high pain tolerance or, you would think that we would be a blessing. Stuff that is highly, I am anaphylactic. I am highly allergic to Toradol. You know how many times people would tell me nobody's allergic to Toradol? I am. It's like, my primary is like, you are just a rare specimen. And I'm like, yeah, but we do exist. So sure enough, they pull all this, since the swelling was starting to go down with each staple they were pulling out, the fear of it splitting open was gone. So we pulled the staples, they put the steri strips, to still keep it there until it fully, would heal or whatever. Swelling went down, pain went away. Now let's catch up to now. Now remember, the doctor who did that surgery is no longer at the place where I get my ortho surgeries done. He's no longer there. Well, apparently he took his notes with him. I told them even before the surgery, hey, don't use staples. But apparently because he took my files, it's not in my file with the doctors that are still there. Doesn't matter. I still told them before my fucking surgery, do not use staples. Guess what I wake up with? Fucking staples. Now, here's the thing. It was a delayed allergic reaction because even the nurse from Sunday and the nurse today both pointed it out. And this is where the issue comes in with fucking Beaumont. About Friday, all right, I'm in the hospital for 3 days after my surgery. I'm in the hospital for 3 days. there's still no allergic reaction. The physical therapist and both nurses, all three agree that it was because of the reason why the allergic reaction was delayed by like a week was because the trauma to my knee, because having a knee replaced, if you watch the video, I haven't watched it yet. I don't know if they filmed mine. I may have to ask the doctor, hey, did you film mine? If you did, can I get a copy of it? I'm weird like that. I'm goth. I'm a witch. You know, it's like, I don't like horror movies, but medical shit like that fascinates me, especially my own medical stuff. But anyway, if you watch that, if you look up the film for like a total knee replacement, it is a major surgery. My physical therapist today said that he's worked at the hospitals. He's been a trainer. So he's taken his students to the hospital to observe these kind of surgeries. And he goes, students pass out. That's how major this surgery is. Well, they had pointed out that the trauma to my leg was so major that it caused my body to fight that first and put the allergic reaction on hold. But since all the swelling and the trauma and the pain was starting to subside, it was like your body just, they were like, your body went, oh, by the way, yeah, we're allergic to these. So it's like, again, I'm unique. Yeah, we are a blessing and a curse. Yeah. So by Friday night, I started noticing that I was getting a little like irritated. I was like, oh, okay, this is, it's itching and, okay, whatever. And I would I would air it out. I would clean around the staple sites, doing everything I'm supposed to do and everything. And I'm just like, okay, fine. But then it started just getting worse. And then Saturday just started getting worse. And it was like, okay, this is starting to burn. Like, okay, something's not right. So it was burning bad, like badly, really burning, like acid burning. If you've never had battery acid hit you before, trust me, it's not a fun feeling. Your nerve endings are on fire. And that's what it was feeling like, my entire knee. Now, even though I have, I can meditate and do all that stuff and everything else, there still comes a breaking point for people like us. And end up going to the ER. I was like, that's it. End up going to Beaumont. I was like, that's it. I was like, I'm on fire. It's like, this is not right. Maybe it's infected. And I was expecting my leg to be ballooned up like the last time, but the reaction was only along the staples. So I assumed that it was just an infection. I thought I had got that was an infection. Go to Beaumont, and they unwrap it, they look at it, and the doctor comes in, and he's like, well, we can't get a hold of your surgeon, and he's an outside surgeon. He's not connected to Beaumont or the VA, so we can't touch this. They took blood, so they did blood work. I have no idea what the fucking results were or anything. My nurse had asked the next day, did they take a culture at least? I said, no. She goes, they should have. If we thought it was an infection, then they should have taken a culture. But they didn't. They didn't even clean it. They didn't clean it, nothing. They just rewrapped it and gave me some antibiotics because the doctor was like, I don't want to touch it. I don't want to touch it. Thing is, the nurse that Sunday, now by the time she showed up, which was a blessing that she showed up, Memorial Day weekend on a fucking Sunday, I couldn't believe that she showed up. I was like, what are you doing here, And she goes, no, something's wrong, I wanted to check on you. Love her to death. Thank you for the fact that she came. 2 two reasons why I'm glad she came. One, because she knew that it was an allergic reaction. Two, she's allergic to staples. So she knew what it was immediately. But if she had not had, by the time I had already been telling Beaumont, I can't even focus anymore. My knee is so much on fire. Tylenol 3 isn't working. And they had said they were going to give me pain meds at Beaumont, but they didn't do it. They didn't give me any pain meds because apparently, again, they didn't want to mess with the other doctor. The doctor was on vacation, so he wasn't even here. He didn't answer me. He didn't answer the nurses. He didn't answer Beaumont. So Memorial Day weekend and no fucking doctor until maybe Tuesday. So think about this. I was already, from the nurse that saw me today, she goes, you were in anaphylactic shock. Because I was telling her what my symptoms were by the time the nurse showed up on Sunday. She goes, you were in anaphylactic shock. She goes, the damage was so severe that you were in a state of confusion. You know, she goes, you could have passed out or you could have died. And so again, here I am angry again at fucking Beaumont. And she goes, why didn't they at least take the staples out? They could have done that. And I said, no, because that doctor swears up and down we didn't want to touch it. She goes, so they didn't even really look at it? Now, all right, so that Sunday, she couldn't do it. The nurse had no authority to take the staples out. But I did. I'm sorry, it's my leg. I'm on fire. Got confirmation that it was an allergic reaction. And I was like, fuck this, they're coming out. So I have the tool to do it. So I end up pulling them out. And sure enough, the swelling started to go down in the area of where the staples are and everything. And of course, the feeling of being on fire, was going down. And she goes, I don't understand. She goes, I know what I'm looking at because I'm allergic to the staples. And I said, it's funny how they always say how rare it is. She goes, it is rare. She goes, but why is it not in your file? Ah! Wow. Why is it not in my file? Yeah, I'm going to make sure this week to contact Beaumont and be like, put it in my motherfucking file. I'm allergic to staples. And also my primary and the surgeon, put it in my file. I'm allergic to staples. Jesus Christ, these fucking people. I know. I don't understand. I understand that people like us are rare, but I don't understand why they gotta lump us in with the common folk. It's like, are y'all trying to fucking kill us? I mean, thank God that B is here because, well, if I had just died and during the night or something, there's nothing she could have done. But if I had passed out, and the thing is, she hovers, she's my caretaker, but also my friend, employee, all of that stuff. But she hovers over me. It's sometimes really fucking annoying, but she hovers over me, kind of thing. And yeah, so I was like, I didn't realize you could go into anaphylactic shock from that kind of stuff, from like an allergic reaction to staples or some shit. I really didn't realize that. I'm still learning shit myself. But yeah. So the nurse on Sunday, thank God she showed up. Because I probably would have waited until, because that was like that evening. I might have ended up going to another ER Probably would have gone to the ER where they performed the surgery. Yeah, so I do take my health seriously. That's one promise I made to my grandkids and friends and everybody. I've made that promise that I will take my health a lot more seriously, and I do. But let me see this. Let me see what y'all were writing here because I was so in the zone. Yeah, we already know El Paso, Las Cruces fucking sucks. Because of the goddamn border, they just use us as fucking lab rats. We're a curse because they don't know what to do with us. I'm allergic to Toradol. Yep, I'm allergic to Toradol. So there's two of us at least right there. Del Sol almost shot me up with it without telling me because no one's allergic. Exactly. A fucking, oh my God, man, these people are stupid. Really? Really, Kat? They're not just moronic, they're absolutely dangerous. Oh, I know. That's the reason why I'm making this video now, and I hope it does go viral, because something needs to be done here. 2 kidney stones came down out of my kidneys, blockages on both sides, kidney function at goddamn 28%. They were going to send me home. Oh my God. Oh my God. Here in El Paso? Well, yeah, definitely here in El Paso, Angel, yeah. Oh my God, these fucking people are ridiculous. Certain allergy meds, copper. Docs doubt me because of fucking, yeah, food allergies. I have food allergies, you know, not necessarily that bad. I mean, yeah, it's itchy and shit like that. I guess it could be getting worse too, but I kind of avoid, you know, the foods. But like, I'm also allergic to NSAIDs. So like aspirin, which is funny. Oh my God, just, what was it? What was it, last week? Yeah. The whole blood clot precaution shit. And it's like, well, aspirin's not an NSAID. Yeah, it is. No, it's not. I'm literally arguing with the fucking nurse. And I'm like, aspirin is an NSAID. You want to call my fucking primary and argue with him? I even pull it up on Google. It's like, is aspirin an NSAID? And it's like, yes, blah, 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 blah. And I'm like, aren't you a fucking nurse in a hospital? How do y'all not know aspirin is an NSAID? It's like, what the? I swear to God, these people are, they just fucking ridiculous. But let me also put here what Angel, who's right here now, what she put on here for me.
See from here that there was something aggravating it and that there was an issue with the situation because your skin was completely inflamed. You were not reacting correctly to the staples. Your body was rejecting them. And the fact of the matter was is that was going all the way down, not just in the area that you showed me. There was a complete indications that your body was allergic to them. And if you already had a prerequisite to be allergic to the staples, they shouldn't have put them in you to begin with. So that would have avoided the whole situation. So the fact is that they completely fucked up and they need to be held accountable for that. Not that they would ever admit their guilt, but at the same time, that needs to be held accountable at some point. And yeah, I'm glad I told you to get your fucking ass to the ER, even though they still didn't recognize it at the time. But I still, you know, that's just something that needed to be looked at, period. The fact of the matter is that you have enough common sense in you to know, just like I do, if these bitches gotta come out, I don't give a fuck if I gotta take them out my goddamn self. I'm not gonna fucking risk dying over the fact that, you know, it needs to be taken out by a professional. Fuck you, I am a professional. I've got the tool, I'm gonna fucking use it, and I'm gonna take it out. I'm not gonna die of anaphylactic shock just because you guys are incompetent.
Yeah. It's ridiculous, the way that, yeah, I don't know. I've had friends that have said, you know, you need to still sue Beaumont anyway for like the puncturing of my lung and shit. And I'm just like, do you have any idea? Dude, do you have any idea how hard it is to sue medical in Texas, period? Yet alone to sue the military? Dude, it's damn near impossible to sue anything medical in Texas at all. And then to tack on that it's the Army, yeah, that's the reason why. I mean, I could talk to a lawyer and see what they say. I mean, I've never spoken to a lawyer about it, but I could at least talk to one and see what the fuck they say. But something tells me they're going to say exactly that. That it is impossible to sue medical. My friend who is suing Del Sol because they killed her sister. It's still sitting in fucking limbo. And this has been, oh shit. This has been more than 10 years. And it's still, it is still sitting in limbo. That is, I mean, it is just fucking hard to sue anything in Texas for medical. But, I mean, hey, you know what? Polar Bear, I'm going to go ahead and look. I'm going to go ahead and look into it at least. And try and contact a lawyer this week and just ask. Try and get a free consultation and at least ask. Because, yeah, they need to be held accountable for what they did and then tried to cover it up. That's the other part about this. I think, oh my God, I will not think. Hopefully I saved the paperwork from when they put the original, like, bullshit to, I mean, I know I have the other one where they fixed it, but hopefully I kept the original paperwork of where they tried to cover it up. But anyway, let me go ahead and get off of here right now. Oh, they will never understand people like us. The ones, the weirdos, the unique people, you know. But they better. I mean, seriously, this week is going to be, yeah, we're definitely an anomaly. This week I'm going to try and figure things out with all the medical stuff. I see the surgeon on Thursday, or his assistant, whatever, who the fuck it's going to be. And I'm going to ask, why did you use staples? I mean, my knee right now, it's better, obviously, because it's not on fire, but it looks eaten up. The damage had been already so extensive from the allergic reaction, and it was a different allergic reaction than the last one. The last one, as I said, it just ballooned up my entire leg. But this one, it just more or less was like eating the flesh almost where the staples were. And that's the way it looks right now. It looks like it's, I don't want to unwrap it to show it right now because the nurse came and, you know, cleaned it and rewrapped it and everything right now. But she was like, yeah, she goes, you could tell you're allergic. She goes, this is a couple of days later. And she goes, yeah, you could tell that you're allergic. You know, it's eaten up. It's hives. And I mean, I looked up anaphylactic reaction, like the symptoms. And yep, had all the symptoms and everything. Didn't have nausea. I did have nausea. It was, yeah. But the confusion, my brain wouldn't function. And I hate that. I can't stand, I mean, I don't like heavy meds. None of that shit that makes me confused or lightheaded or, you know, a zombie. I hate meds like that. And the fact that the pain was that intense that it was causing me to, like, I can't even think correctly. Yeah, that was, but as I said, when the nurse said you could have died, I looked at her like, what? I mean, she wasn't joking, she was straight up. But I still looked at her like, what? Like, so I looked it up after she left, like, what is she talking about? And yeah, I looked it up. That, yeah, I could have gone, you know, it's like, oh my God. So I could have died. I could have fucking died from this. And it was, and of how bad the damage is now is all because Beaumont didn't want to take the fuck. So I went more than 12 hours. Well, let me see, what, 1 a.m.? Yeah, about 1 a.m. Well, the staples were still in. So 1 a.m. from Beaumont, and then she didn't show up. So we're talking like 15 hours later. So I went through 15 more hours of intense pain, all because Beaumont didn't recognize it was an allergic reaction. And remember, the doctor, he literally had his hands in his pockets. I don't even want to touch it. I don't want to touch it. I don't want to get in trouble for touching another doctor's, but didn't even recognize that it was an allergic reaction and didn't take out the staples. So we're talking 15 extra hours of intense pain that I could have died, all because Beaumont's incompetence or negligence. But I hope this video goes viral. If they get mad at me, I don't give a shit. What are they going to do? Kill me?